Hi, today I'm going to be evaluating the social media performance of the company Babylon Health on metrics such as engagement, share of voice, and reach. Babylon Health is a digital first healthcare service provider based out of the UK, established in 2013. It uses AI integrated technologies to provide services such as online GP consultations, appointments, medication delivery, symptom checker, and health tracker. And it provides these services through its mobile application and website. So Babylon Health is present on almost every major social media platform. It has the largest followers on LinkedIn, approximately 70,000, followed by YouTube, and it has the least amount of followers on Facebook. This can be due to the fact that it invests heavily in LinkedIn marketing and has a lot of engagement on LinkedIn. For social media traffic, most of the traffic to its website comes from the Telegram web app. This is also one of the platforms that the company heavily invests on, and followed by YouTube. The least amount of traffic to its website comes from Facebook, and this is maybe where the company should invest some of its paid media. Engagement, as can be seen for the engagement rate is very healthy for YouTube. However, it can be improved. For Instagram and Twitter, the engagement rate is very poor, especially compared to its competitors. Average engagements per post on Facebook for Babylon Health is just 1.76. However, for its major competitor, the NHS, is 533. And this is because the NHS does a lot of paid media. Even the number of uploads on Facebook, NHS has a higher quantity of uploads, even though it may be inconsistent as compared to Babylon Health. And hence, this can be owed to the fact that NHS has more engagement. Some other reasons for low engagement can be one, low frequency of uploads. Secondly, the content is not exactly tailored to suit each of the platforms. There is a lack of an always on sustainable strategy, and there is no paid media amplification for some of the platforms. This is the data for share of voice. As can be seen, Babylon Health has a pretty large share of voice compared to its competitors, Ada Health and NHS. NHS does better, but it's still healthy. Mentions over time have actually increased for Babylon Health, especially after January 2023. This can be owing to the news about health strikes, healthcare worker strikes, and the likes of that. As can be seen, Twitter accounts for the largest share of mentions for the company, and hence this is where the company can really focus on enhancing their social media presence and leveraging the mentions to increase their engagement rate on the platform. Sentiment analysis, as can be seen, is mostly positive, and hence that is good news. Some of the word clouds, that is the words and search results associated with Babylon Health. For reach, you can see that Babylon Health's reach has actually fallen by 30% in just the last month, from 5.7 million to 411.6 thousand. If you this to the competitor's current reach, which is at 200 something million for both Ada Health and NHS, Babylon Health needs to really step up their game in terms of reach. So these are the recommendations. The objective is one, obviously, to increase the engagement rate for the platforms to bring it to at least 1.5%. Develop a sustainable, always on strategy, which is tailored to each of the platforms, and maintain their share of voice and increase their reach. The approach will be to leverage electronic word of mouth, enhance their social media presence, and this can be done by using content automation tools and websites and software such as Hootsuite, Brandwatch, and Loomly. What kind of content is expected from a healthcare provider? One, definitely informative videos that debunk any misconceptions related to any health illnesses, to raise awareness about certain illnesses and change public perception, and lastly, to show that they're reliable and trustworthy and people can turn to them. So for Twitter, they should increase their frequency to at least 5 posts per week, retweet and reply to posts that mention their brand name, because there were a lot of mentions on the app. Keep up with customer complaints and feedback, keep an eye on what people are saying, and put content that calls for a conversation, that calls for people to reply to it, as can be seen in the example on the screen. For YouTube, they should focus on long form content, that is, long videos. They should also put bits of their long videos as YouTube Shorts to reinforce those videos, and increase frequency to 2 videos per week. Below is an example of their most watched video, which is an informative video by an expert, and hence that is the kind of content they should focus on. For Instagram, one again, increase their frequency of posts, use short form content because that is favored by the platform, use influencers and collaborations to raise awareness and spread awareness about different illnesses, and encourage user generated content by telling people or giving benefits to people who provide testimonials and good feedback on the application and reposting those. For Facebook, they have to increase the frequency of posts to match Twitter. They have to post a variety of content formats because Facebook supports that videos, text, as well as any short form videos. They have to use paid media amplification because the followers are less as well as their reach is less on this platform. These are some of the trending topics for healthcare issues on the app that the company can make content around. This is their most engaged post on Facebook. What happens when you don't wash your hands? And hence this gives an idea about what kind of content people want to see from their page. Lastly, I'd like to talk about what I've learned from this project about the company. It's doing very well as a private healthcare service provider, especially when it's competing with the National Health Service here in the UK. However, it can improve on these social media aspects to really give its customers an experience they've not had. And yeah, this was it for the presentation. So thank you. Here are the references. These are some of the tools that we used. Thank you.